I think CardioCel has a wide application from neonatal age to pediatric age. The main advantage is that this bioscaffold is completely acellular, and with the ADAPT technology it is probably free from calcification long term. We have medium-term results, and these are very promising in this respect. And I think the major advantage is also pliability, especially during neonatal intracardiac repair. Up to now, I have been more systematic in the use of CardioCel for intracardiac and RVOT reconstruction. So I don't have an exclusion criteria for using CardioCel. I use for septal reconstruction in transposition VSDs and truncus arteriosus neonatal age, interrupted aortic arch neonatal age. And beyond that time, the usual VSD, conoventricular VSDs, outlet VSDs, tetralogy or malalignment type VSDs. In the right ventricular outflow tract, I see an application, especially in tetralogies, where I have a preference to preserve the pulmonary valve and perform a small ventriculotomy incision. So this bioscaffold is useful for RVOT reconstruction as well. On selected cases, I've been using CardioCel for repair of aortopulmonary windows, and the lowest weight was 1.8 kilos, and I reconstructed the aorta using CardioCel, detaching the window and reconstructing the pulmonary side with autologous pericardium. I used CardioCel also for reconstruction of the neopulmonary artery and arterial switch operations, but in very selected cases. The integration of this bioscaffold is by endothelial apposition, which is also seen in other type of patching materials, bovine patches most commonly. I think the major advantage is freedom from calcification, especially in pathologies where, let's say, truncus arteriosus with after reconstruction of enclosure of the VSD. In future years, there is a potential for implantation of RV to PA conduits, and it's quite useful to have a pliable material that has not calcified. And when I reoperated to implant an RV to PA conduit in previously operated children with a VSD closure, I did not find any sign of calcification at the site of implantation. It's still a preliminary experience, so we have to verify in the future, but the preliminary results are encouraging. Previous materials like bovine patches have shown less pliability in terms of mechanical properties. I'm not saying that they're not good materials. I'm just saying that I prefer the pliability of CardioCel, because even considering a simple perimembranous VSD, perimembranous VSDs have a 3D displacement, and CardioCel is adapting to the recesses into the myocardial folds better than any other material I've used.